Hi everybody, today I want to speak to you about stuttering or stammering. Despite what one could think or imagine, it is quite a common condition, a condition that generally starts at a very young age. Now, there are different types or reasons for stuttering or stammering, but the most common cases are developmental uh, stammering. So, these are the most common patients that come to me as a homeopath to seek help. That means the stammering has started very young in age, and there is no, let's say, brain tissue damage. So there is no issue like that. So there's no neurogenic causes, there's no pharmacogenic causes. That means sometimes certain drugs could result into stammering. But the most common cases that I see is developmental stammering, and a lot of times these cases have a sub um, category or something in the background which is psychogenic factors. That means there are certain situations, certain emotional factors that exacerbate these their symptoms. Now, stammering can happen to both boys and girls. It can sometimes start late in age, but generally starts young in age. And girls, women, have more chances to recover sooner. So, as adults, you will see stammering more common in men versus women, which is interesting. And more research needs to be done on why that is. But regardless, stammering causes a lot of social trauma. It's very difficult for these children as they grow older to deal with social situations. Sometimes they can become a recluse. They start avoiding things they used to enjoy previously. They start minimizing their interactions, and it has a lot of impact on their confidence. A speech therapist has a great role to play. It helps in correcting some long pauses, helping them, become more comfortable with certain syllables, phrases. But other than that, in conventional medicine, there isn't really anything else to offer. Homeopathy, on the other hand, really helps these cases. I have personally treated several cases of stammering, and I have seen children improve, seen adults improve. The long pauses become shorter, their confidence boosts, they become fluent in certain syllables and phrases, and they overall cope much better. You will see this feedback from their parents, from their caregivers, from their teachers, from their employers. They go about their life as normally as possible.